Hello and welcome to Foreign Dispatches, the program that takes you around the world in 25 minutes. I'm Teniola Shoboale. From Europe to Africa, authorities tighten restrictions to curb the spread of COVID-19. Plus, officials in the US tell hospitals to speed up vaccine distribution. England is starting the year 2021 under a national lockdown, and Prime Minister Boris Johnson warns that the coming weeks will be the hardest yet. Amid rising cases of the coronavirus, medical workers say they are overwhelmed by the toll the pandemic is taking on them.
From tears at the end of a long shift to sleep problems, doctors and nurses at St. George's Hospital in London say they are finding it difficult to cope as COVID-19 infections continue to soar in the United Kingdom.
I personally cry when I get home quite a lot actually at the moment. Sleep, we're suffering with sleep problems, I think a lot of nurses and doctors at the moment as well.
On Monday, British Prime Minister Boris Johnson ordered a new national lockdown.
Our hospitals are under more pressure from COVID than at any time since the start of the pandemic. In England alone, the number of COVID patients in hospitals has increased by nearly a third in the last week to almost 27,000. And that number is 40% higher than the first peak in April. It's clear that we need to do more together to bring this new variant under control while our vaccines are rolled out. In England, we must therefore go into a national lockdown which is tough enough to contain this variant. That means the government is once again instructing you to stay at home. You may only leave home for limited reasons permitted in law, such as to shop for essentials, to work if you absolutely cannot work from home, to exercise, to seek medical assistance, such as getting a COVID test, or to escape domestic abuse.
As Britain grapples with the world's sixth highest death toll and cases hit a new high, the country's chief medical officers say the spread of COVID-19 risks overwhelming parts of the health system within 21 days. Officials say the surge in cases has been driven by the new variant of COVID-19, and while they acknowledge that the pandemic is spreading more quickly than expected, they say there is also light at the end of the tunnel: vaccinations. But even with the vaccines being rolled out, the number of COVID-19 cases and deaths keeps rising.
We have people in their 40s, their 30s, their 20s on our intensive care unit dying of COVID. We are having to think about whether we do cancer surgery. We're having to postpone cancer surgery because of the number of COVID patients we have in. So even if you don't think you are doing any harm by bending the rules a little, you are. It has a knock-on effect. And we are seeing the knock-on effect here.
More than 75,000 people in the UK have died from COVID-19 within 28 days of a positive test since the start of the pandemic. A record 58,784 new cases of the coronavirus were reported on Monday.
Over in Zimbabwe, parties and New Year celebrations that attracted thousands with little social distancing or mask wearing have triggered panic and a strict 30-day national lockdown. The government says the number of cases recorded over the festive season almost doubled from infections recorded earlier in 2020.
The Zimbabwean government has put the country under a harder lockdown for 30 days from January the 5th as it tries to curb rising COVID-19 cases. All public gatherings except funerals have been suspended, while an overnight curfew that previously began at 10 p.m. now comes into effect from 6 p.m. Before the festive season, cases had been steadily rising, but an almost doubling of new infections between November and December has brought matters to a head.
Your main issue and how you must think about it and what most likely informed that decision is that all our COVID admission facilities were almost 100% full. What that means is when the number of new patients were almost doubling every 24 hours, you're going to have a situation where you have 100 people who need admission in one night and they have nowhere to go.
Even amid surging cases, hundreds of people still ignored social distancing guidelines in public spaces. Given the adverse impacts the first lockdown had on livelihoods, there are mixed feelings about the latest restrictions.
Some people are unhappy because the lockdown will affect their incomes, but this is the only way we can save lives.
30 days is too long. We should have a lockdown for 14 days, like in South Africa, and we be allowed to work under strict regulations.
While the government lacks resources to help all those who will be hardest hit economically, it's being urged to also cater for those that will be affected physically.
One of the things we have to really do in these 30 days is to increase the admission capacity, increase the amount of oxygen, the supplies, so that when we do reopen, it's going to be obviously a phased reopening, but then we have increased capacity.
Zimbabwe's response to the COVID-19 pandemic has been hampered by shortages of ICU facilities, personal protective equipment, and industrial action by doctors and nurses. With a fragile health system, health experts have warned of an impending health catastrophe in Zimbabwe.
South Africa, the first African nation to top 1 million COVID-19 cases, had been hoping to get its hands on vaccines to roll out a campaign as soon as possible. But those plans are shaky as concerns grow over the country's preparedness and fears that the new variant currently driving the country's second wave may not respond to available vaccines.
The South African government says it's planning to vaccinate a minimum of 67% of the population, approximately 40.3 million citizens by the end of the year, to achieve herd immunity. On Sunday, the country's health minister Zweli Mkhize announced that the government had secured enough vaccines to immunize 10% of the population.
I have personally participated in discussing with the leadership, the global leadership of the various manufacturers. We've done that in two of the capacities in which we serve. On the one aspect, on behalf of South Africa, we have been involved in a lot of discussions. Literally, every second, third day, we are actually involved with some of the discussions. And at the same time, I'm also part of a task team that's been created by President Cyril Ramaphosa, which is the African Vaccine Access Task Team, which is led by Strive Siwiya and Masiwiya, and a number of other participants that would include the president of the Africa Exim Bank, as well as the Commissioner for Social Affairs in Africa, and the CEO of Africa CDC. So in these discussions, we've been able to gain access to a lot of information, for example, that suggests that most of the countries that have started vaccination, because of the vastness of their resources, they've been able to bid for all the vaccines much earlier, long before even the vaccine outcomes trials were released. So they'd actually put up lots of resources at that level. Unfortunately, we have to work together in a situation where we've got a much more constrained environment. But at this point, we're quite comfortable that at the time of the rollout, we would have been able to catch up with most of those countries that are doing, at this point, that have already started some of the vaccination.
But not everyone is convinced. Some believe that the aggressive goal wouldn't be achieved due to lack of adequate preparations.
It's simply an aspirational goal and unlikely to materialize in a South African context for two major reasons. The first reason is that we haven't secured a supply of vaccine to meet the target. And the second reason is that there's been absolutely very little, if any, planning in terms of how we will go about vaccinating 150,000 people per day, 7 days a week for the first month, and after that, 300,000 people per day for the next 9 months.
South Africa had placed all its collective eggs in the COVAX basket. And now we have a situation where we didn't start our bilateral engagements quick enough when the rest of the world was doing that. Now we're talking about a situation where the minister is saying that 67% of South Africans need to be vaccinated by the end of the year, which is an audacious task considering the fact that we still haven't started on the plan, and yet we also don't have experience of rolling out vaccinations at this scale.
Amid fears of a new coronavirus variant, British scientists expressed concern on Monday that COVID-19 vaccines may not be able to protect against the variant identified by South African genomics scientists and which has spread internationally. But a South African researcher studying the variant says it's unlikely to completely negate the immunizing effects of the vaccine.
We've been a bit cautious about kind of flagging the concern about the vaccines is that for many of the vaccines, they are thought to induce quite a broad immune response. So they produce antibodies that will target different parts of the spike protein, not just necessarily one part of the protein. And that's why we think that although these mutations may have some effect, they're very unlikely to completely negate the effect of the vaccines and the different vaccines.
However, as research continues and with the new variant driving the second wave in the country, officials warn that it makes the need for a global rollout of vaccines even more critical.
The governors of the U.S. states of New York and Florida have warned hospitals that they must administer coronavirus vaccines more quickly. In New York, the governor says hospitals must give vaccines within a week of receiving them or face a fine and loss of future supplies.
3 weeks ago, New York City intensive care unit nurse Sandra Lindsay was the first person in the United States to receive a coronavirus vaccine. And on Monday, January 4th, she was the first to get her second and final dose.
No, it didn't feel any different. As a matter of fact, maybe Dr. Chester's hand got a little gentler. So it didn't feel any different. It just felt like a joy going in, and I'm really, really grateful for the opportunity.
It's been 21 days since her shot kicked off a massive nationwide vaccine rollout that by all accounts is moving way too slow. The U.S. Centers for Disease Control and Prevention reported that the U.S. federal government has distributed more than 13 million vaccine doses to states and territories around the country, with only around 4 million of those doses actually administered. And states are getting fed up. New York State Governor Andrew Cuomo announced Monday that New York will begin fining hospitals and will decline to provide them with further doses if they fail to act with urgency.
From the day you receive the allocation, you have 7 days to use that allocation. This is a very serious public health issue. And Department of Health, Commissioner Zucker is very firm about making sure the hospitals step up and deliver here. So any provider who does not use the vaccine could be fined up to $100,000. Going forward, they have to use the allocation within 7 days. Otherwise, they can be removed from future distribution. As you saw, we have almost 200 hospitals. If one hospital isn't performing, we can use other hospitals.
In Florida, where officials have put senior citizens ahead of many essential workers for getting the vaccine, Governor Ron DeSantis announced a policy that would allocate doses to hospitals that dispense them most quickly. Florida will also deploy an additional 1,000 nurses to administer vaccines and will keep state-run vaccination sites open 7 days a week. The U.S. government is under intense pressure to speed up the vaccine rollout as cases surge, with New York announcing on Monday that it is the latest state to detect the most contagious strain of the coronavirus first found in the UK. Cases have already been detected in Colorado and California.
When Foreign Dispatches returns in just a moment, India embarks on one of the world's most ambitious vaccine rollouts. More details in a moment. Stay with us. You're still watching Foreign Dispatches on Channels Television. With a COVID-19 caseload that surpassed 10 million people, India is the world's second worst hit country by the coronavirus pandemic, trailing only the United States. But it is aiming to lift itself out of the crisis in the coming months with a massive vaccination drive, covering in its first phase almost as many people as the entire US population.
India, a country of 1.35 billion, is planning to inoculate 300 million frontline workers, elderly and vulnerable people by early August, and preparations have been months in the making. Indian drug regulators on Sunday gave the go-ahead for 2 coronavirus vaccines, one developed by AstraZeneca and Oxford University, and the other conceived locally by Bharat Biotech and a government-run institute.
After adequate examination, the CDSCO has decided to accept the recommendations of the expert committee, and accordingly, vaccines of Messrs. Serum and Bharat Biotech are being approved for restricted use in emergency situation, and permission is being granted to Messrs. Cadila Healthcare for conduct of phase 3 clinical trial in India.
The Serum Institute of India, the world's largest vaccine maker, is producing the AstraZeneca and Oxford vaccine locally, having taken on a huge risk to manufacture the vaccine months before approval from regulators. But the vaccines, locally branded Covishield, won't be available to other countries until March or April, as the Indian government has restricted them for export. Ahead of the mass vaccination drive, the Indian government has also been recruiting and training additional vaccinators and ramping up its stock of cold chain storage equipment such as walk-in coolers, freezers, deep freezers and ice-lined refrigerators over the past few months. Over the weekend, the country conducted a nationwide COVID-19 vaccine drill at 286 sites across India to familiarize officers on all levels with the operation guidelines. Some 114,100 workers have been trained on tasks such as verifying personal data, conducting cold chain and logistics management, and uploading information using government software.
Over in the Middle East, residents of Dubai in the United Arab Emirates, where vaccination is free, have divided opinions on the safety of the COVID-19 vaccine. Our correspondent, Mayowa Adegoke, speaks to some who share their fears in this next report.
Fireworks on the world's tallest building. Music and shouts of excitement. In Dubai and the entire United Arab Emirates, the year of COVID-19, 2020, finally gives way for the new 2021. Hopes are high for the world to return to normal this year, especially now that scientists have produced vaccines for the coronavirus.
I am super positive. I'm really excited. I know it's going to be a great year. We're going to move forward from everything and all the chaos that's been happening in 2020. And I'm definitely prayerful. I'm keeping positive, like I said, and I look forward to it very much so, yeah.
In Dubai, local authorities are giving jabs at no cost. A brilliant move for the tourist destination, which has found a way to keep its economy going with strict guidelines in place and an ambition to return to normal sooner than later. However, there are still doubts about the safety of the vaccines.
There is going to be that segment of society that is happy to take it and believes in it and has the faith that it's going to work. And there's the rest who are going to be not just cynical, but concerned and will have that anxiety that this may not be it. And the after effects or the side effects may be greater and may outweigh the benefits of having the vaccine.
As a teacher, I do feel that taking the vaccine, being a frontline worker is pretty important. It's pretty vital for the safety of the other staff, for the safety of the students. But at the same time, as a scientist, because my background is of science studies, I don't feel like they've done enough in order to clinically trial everything. They've not gone through the vigorous process of taking their time to make this vaccine. So what are the precautions? What are the long-term effects of it? We don't know yet. So for that reason, I'm totally in between.
Firstly, I won't take the vaccination I'm not confident about it because I feel like these things need a lot of research. First of all, we didn't even know what COVID-19 was when it actually first started. So how did they quickly come up with a vaccine, and how are they sure that it's actually going to work? Because of this, I don't think I'll take it, and because of this, I'm also not confident in the vaccine. One of the other reasons why I'm not confident in taking the vaccine for COVID is because I've had reactions to vaccinations that have been tried and tested, such as the flu jab, or which I took, and I reacted horribly, and I just said I'm not going to take it anymore. And this is a vaccine that have people, they've been tried and tested over the years, so, and it didn't come out of the blue within 8 months or 6 months. Now that's what COVID is it just came out of the blue. So there's no way that I'm trusting, something that hasn't even been around for a year. So yeah, that's my take on it.
Valid fears, which may complicate things as not getting vaccinated poses a risk for all.
The fears are absolutely understandable, but then this is a product that's got a lot of science behind it. Generally, before new medications or vaccines are released for public use, it goes through a lot of trials. And when we talk about trials, we talk about testing these vaccines on thousands and hundreds of thousands of people. So I think it's safe. We're still a little bit far away from returning to normal. Probably, I'm hopeful maybe by the beginning of 2022, a significant proportion of people would have been vaccinated. And the earlier we achieve that, the closer we'll be to getting back to normalcy.
In the meantime, many others have continued to take the jab as government steps up its campaign to get as many people who are willing to get vaccinated. Will this encourage skeptics to follow suit? Only time will tell. From Dubai in the United Arab Emirates, Mayawa Adegoke for Foreign Dispatches.
And finally on the program, here's something to keep you busy this year. Stuck at home during Germany's spring lockdown, 4 sisters devised a coronavirus board game. The game, called Corona, took its inspiration from news stories and has kept the family unexpectedly busy ever since.
At a loose end during Germany's first lockdown, the 4 Schwaderlapp sisters decided to put their long hours indoors to good use by inventing a coronavirus board game that is selling by the thousands.
We developed the Corona game while sitting at home on the lockdown. We heard in the media and saw in supermarkets nearby how everyone was panic buying. That shocked us very much. And that's why we wanted to deal with the whole situation and then invented a board game for it.
Corona can be played by up to 4 players who compete to buy groceries for an elderly neighbor. The players collect and swap game cards, and the winner is whoever delivers all the items first. Hurdles along the way include encountering the virus, which sends you into quarantine, or finding the hoarders have already snapped up all the pasta or toilet rolls.
The main idea is to show solidarity with one another. So you go shopping for a neighbor who belongs to the risk group and doesn't dare to leave the house. Then there is tension because you can put viruses at the feet of the other players and make things more difficult for them.
The sisters worked on the game most evenings during the spring lockdown, gradually incorporating more elements from news broadcasts about the pandemic.
It was a big distraction, really. Maybe a way to handle the situation much better.
Impressed with his daughter's efforts, their father decided to commercialize the game by hiring an artist to design cards, board, and box. So far, he's sold 2,000 copies and signed up for a toy store as a secondary distributor.
And that's Foreign Dispatches this week. Remember that you can catch up with all our top stories on channelstv.com. Thank you so much for watching. I'm Teniola Shoboale. I'll see you next time.